Hi, and welcome back. We have Carola Hauer, Crisis Stabilization Unit Manager for Tri-City Medical Center, joining us. Welcome.
Thank you.
So what is the Crisis Stabilization Unit, and what does it address, or designed to address, I should say?
It's exactly what the name says. Somebody comes into the ER, and they're in a psychiatric crisis, and we're trying to not just assess, give medication, send the patient home, but we're also trying to stabilize all other aspects. So this is an outpatient unit. It's a step between the emergency room and the inpatient behavioral health unit. And there we have about 24 hours. We have a window of about 24 hours trying to apply comprehensive services to the patient, which includes obviously a psychiatric nurse, nurse practitioners, physician assistant, psychiatrist. We have social workers, we have psychiatric liaisons, and the liaisons are also there 24/7. They're marriage and family therapists, or LCSWs, they're licensed social workers. And the whole team has been with us for a long time. So we have a great team that can address the whole problem. It's not just giving the medication and then sending the patient back home. But people in crisis need a little bit more. And what they need are follow-up treatment services. And so we try to incorporate all those things in our treatment.
So is it an, I don't know, is it an inpatient or an outpatient? Is it?
It's outpatient, it's considered outpatient,
Okay.
but it's like the ER. The ER is an outpatient facility. Sometimes we may not think of it that way. So it's an outpatient facility. And our goal is to sift through and see what every patient needs, and will they actually, some of them may be candidates and will need actually the intensive treatment of an inpatient behavioral health unit. But that's our job, to sift that out. And to watch a patient. We have 24 hours versus when you go to an emergency room, that's usually a quick visit. And what we have the opportunity to observe the patient much longer and collaborate with the patient, collaborate with the family, their support, and look at what's the whole package that the patient actually needs.
Do you keep them from a certain period of time? They come in and you're saying it's kind of like an ER. Is there a mandated set of time? Do you keep them? How long do you keep them in this?
So we have a bracket where we could say this is a maximum time. So if somebody stays close to the 24 hours, it's very likely that that patient may need inpatient behavioral health units if we can't help them to decompress and to address the crisis and to get stabilized. What every patient has, though, everybody goes to the emergency room, everybody gets a medical screening exam, and that includes labs. But all the psychology and all the psychiatric medications and everything are going to be addressed in the Crisis Stabilization Unit. So we can be more specific. Somebody may come in and they have, for whatever reason, not been able to take the medications or haven't been compliant. So we have the staffing actually to help the patient, and we know what dosage do we start this patient on and how do we stabilize them responsibly. That's specific knowledge, in psychiatry. So that's what we can apply while we're looking at all the other aspects. How do we improve coping? How do we help the patient find resources? So it's multidisciplinary, and it's a bit more intense, so a patient can hopefully benefit from it and be reintroduced to the community and go back to work and function at a level that they may have functioned before.
So the stabilization unit, it's not something they keep coming back to. It's just something that kind of, okay, what's going on and how to sort of assess it. And I noticed, I went on the website and I noticed that there are other centers that have a crisis. Is this a branding kind of thing?
It's really a new program. There are a number of facilities that have that at this point in North County. We have Palma Hospital and ourselves, Tri-City. But I believe that the trend as of right now is to have more of these facilities, because we have ERs that have a lot of psych patients. Numbers have increased. We're trying to address the treatment issue, and we're trying to get the patient to get back to a level of functioning.
And with this, in the crisis stabilization unit, you had mentioned medication. How does medication play into this crisis stabilization unit?
Plays a huge role. Just like when you look at psychotherapy or psychopharmacology, we have a lot of research that shows that combined we have the best results. So somebody goes to a psychiatrist, perfect, that's the medication side. If we add psychotherapy to the medication, we have better results. So that's also the premise in the crisis stabilization unit. So we are assessing the medication needs. So that may be somebody who may just start on a medication and hasn't been not diagnosed before. This may be somebody who has been on medications and for whatever reason hasn't been able to follow up on it. This may be somebody who is on medication but has a break, psychotic break, bipolar break or something, and now where medication needs to be adjusted, or maybe there has to be a change. So we have the team available, and we're like hand in hand. The psych nurses are my favorite people there. I can do the psychology, they can do the pharmacology. And the whole team, I can go to the psychiatrist and consult and find out what's the component here, what do I need to look for. But I can also give input and say, this person may have been diagnosed one way or another, but I have just found out that there is a tremendous amount of grief and loss underlying. And they may not have shared that in their outpatient, with the outpatient provider.